Hey everyone, we've got another heart today. This is number 1531 in our collection. And the heart would have sat roughly in the chest like this. You can see that the lungs still remain on block. So the anterior surface would have been coming out towards the screen, posterior towards the turntable, head or superior here, legs are inferior here, left over here, and right over here. Now, right off the bat, you'll notice something unique and interesting. There does appear to be a large conduit that exits from what appears to be the apex of the heart, but let's do what we normally do, which is try to identify what at least externally appears to be the morphologic right atrial appendage, and then go from there. And when we look at this, we find what appears to be a triangular, broad-based, or pyramidal appendage consistent with the morphologic right atrial appendage. So we'll go ahead and open the heart there. And when we do, we find that there's pectinate muscles that spill outside the confines of the appendage, consistent with the morphologic right atrium. And now, when we open this up more, what's particularly prominent is this venous valve that nearly divides this right atrium into two separate sections. And this can certainly happen sometimes and can even cause significant hemodynamic obstruction. We also find the superior caval vein, which drains into the roof of the right atrium. And we can go ahead and try to follow that back. Let's go ahead and see if we can't find where it enters. So here is the superior caval vein entering into the roof of the right atrium. And here is that tendon of Totaro, and here is the mouth of the coronary sinus. Now we do find that there is a right-sided atrioventricular valve that does appear to have 3 leaflets, 1, 2, and 3, and there do appear to be connections directly to the ventricle here. But we immediately see that this right-sided atrioventricular valve opens up into a ventricle that appears to be a morphologic left ventricle with fine crisscross trabeculations, but that there also is a second left-sided atrioventricular valve that also opens up into this morphologic left ventricle, consistent with double inlet left ventricle. So once again, here is the left-sided atrioventricular valve. Here's the right-sided atrioventricular valve. Here is the left ventricle. And then from the apex of the left ventricle, there is a conduit that has been placed surgically that then appears to insert into the descending aorta. So here is a left ventricle to descending aortic conduit. And there does appear to be a valve inside this conduit as well. Let me try to expose that a little more. So here is the valve inside the conduit. I'm sorry, I can't get a great image of that. But let's go ahead and go back to this left ventricle. So once again, here's the right-sided atrioventricular valve, the left-sided atrioventricular valve. Here's the morphologic left ventricle. And then here is an outflow. And we find a 3-leaflet arterial valve here, 1, 2, and 3, with 3 sinuses. There are no coronary arteries arising from within this, and it does seem to give rise to the pulmonary arteries. So here is the pulmonary trunk. Here is the left pulmonary artery. Here's the right pulmonary artery. So from the morphologic left ventricle arises the pulmonary trunk with the pulmonary valve, the pulmonary trunk, and the branch pulmonary arteries. So far we're dealing with usual atrial arrangement, double inlet left ventricle, and at least so far what appears to be discordant ventriculo-arterial connections. Now let's try to find the right ventricle, which is actually this small hypoplastic cavity here. So here is the extremely hypoplastic right ventricle, and there is a ventricular septal defect that does open up into the right ventricle, the left ventricle. And from this small chamber arises the aorta. So once again, discordant ventriculo-arterial connections. And this aortic valve does appear to have 3 leaflets, 1, 2, and then this one here that's transected with 3 sinuses, 1, 2, and 3. So once again, here is the morphologic right ventricle that's anterior and rightwards that gives rise to the aorta. And here's the ascending aorta, the transverse aorta, head and neck vessels, and then the descending aorta, which courses posteriorly and then accepts this LV to descending aorta conduit. So why don't we just go through the anatomy one more time. Here's the right atrium with a pretty prominent, venous valve here. Here is a right-sided atrioventricular valve that opens up into a morphologic left ventricle. This morphologic left ventricle also has a left-sided atrioventricular valve that drains into it. So double inlet left ventricle. From the left ventricle arises the pulmonary trunk, and this pulmonary trunk is guarded by a 3-leaflet pulmonary valve and does give off the branch pulmonary arteries. And then anterior and rightward is a hypoplastic right ventricle from which arises the aorta, which is guarded by a 3-leaflet aortic valve. And then there is a LV to descending aortic conduit as well. And then just to mention, here is the left atrial appendage as well. So an interesting heart with double inlet left ventricle, discordant ventriculo-arterial connections that has undergone a left ventricle to aortic conduit placement.